Conventional implants usually needs a lot more bone structure, therefore the diameter of those implants are wider, and therefore it needs a lot more time for healing, around 4 to 6 months. And usually that will just replace the root part of the tooth. Then after that, you put the other part, which is the top part of that implant, where the crown will be sitting. And most of the time they need a bone graft. Where mini implants is a small diameter implant, where we don't need to put any bone graft, and also result is less invasive. So we can be able to fix and place the tooth in a couple of weeks, and you will have your implant and your tooth in that time. Because there is not two sections, there is not a junction where the plaque can get and the implants can get infected. So one implant or one size implant, like the mini implants, have a solid surface where that infection will happen almost zero. And the other part is that it's less costly because we only need one piece instead of providing two pieces.